Pain after major surgery, such as joint replacement, appendicitis, and gallbladder removal, can be debilitating and long-lasting, so doctors often prescribe painkillers that are much stronger than the ones sold without a prescription. But patients using these drugs run the risk of chronic opioid use, which is defined as taking more than 120 daily doses during the first year after the operation. According to National Institute on Drug Abuse, in 2010, 8.76 million Americans were addicted to prescription medicines. Researchers at the Stanford University School of Medicine looked at the records of more than 600,000 patients who were not taking any opioids prior to surgery. They found that some were at higher risk of becoming addicted.
The risks range from about 1.5 to 5 times, depending on the surgery.
Researchers found that the risk is higher for men than women, for older rather than younger patients, and for those who previously used some common anti-anxiety medicines.
And also patients with a history of drug abuse and alcohol abuse are at high risk for chronic opioid use following their surgery.
Dr. Sun says using prescription painkillers correctly seldom leads to addiction, but close consultations with your doctor is highly recommended.
Physicians should closely monitor their surgical patients to see how much opioid they are or aren't taking, and just be aware that they may be at higher risk for using opioids chronically.
Researchers say the first signs of increased risk of addiction are when patients rise the dose of the drug without consulting a doctor or go to several doctors to get multiple prescriptions without letting any of them know. George Putic, VOA News, Washington.